All right. So next, I report about the medical device working group. This working group, as I said last year in the symposium, that we are expanding the leadership team and establish collaborations across OHDSI and beyond. The one key result will be establish the subgroups and the leadership teams. So you will see later that we have, for some subgroups, we do have leaders and we do have objectives, but for some we are still vacant. We are looking for volunteers to lead the group. And then we have another task that is really critical, time sensitive, is that we want to respond to the FDA Medical Device Active Surveillance, RFI, by the March 30th. So I had sent out emails to reach out people to ask a time to set up a meeting this week. But if anybody else who felt that you want to contribute to this effort, please let me know. Oh, you might, if you don't have my email, you might just let Craig know and he can pass it to me. Then I'm thinking for this group, we are still small numbers and we really need to establish collaborations and brainstorming ideas. I'm thinking we need to, there are a couple of goals, object results in the later quarter is develop activities to establish collaborations, and then maybe thinking of planning a thinkathon or hackathon at the annual symposium. Next. Yeah, next will be device data subgroup. Anthony or Carrie, if you are on, please talk about your subgroup.
I'm here. I can discuss it.
Okay.
Carrie, are you with us?
I don't think so.
No. Okay. All right. So this is the device data subgroup, and the first objective is to enable the device standardization efforts to be interoperable with OMOP to support large-scale device data analysis. We'd really like to invite and welcome people with device data to map their data to the OMOP CDM, or at the very least join the working group calls and tell us why they don't want to or why they failed. And we'd love to be the touch point for them to answer questions or to help them with their mapping. So for our key results for Q2, the first is to explore the current OHDSI data sets for device data coverage. Next, to explore and evaluate extending the OMOP CDM. There's some discussion about the whether or not the current CDM structure is not welcoming to people with device data, despite the fact that we have a device exposure table. So we'd love to invite people with device data to join our call and the CDM working group call to discuss if and in any way the current CDM is not in a format that's helpful for their current structure of their data. And finally, explore tools and methods to include device data into the OMOP vocabulary. That's it. Thanks.
Yeah, next will be Andrew to talk about another subgroup.
Yes, and just to give a little bit of a framework, we're talking about two different kinds of device data, maybe across these subgroups. So there's device identifier information that just says here's what people were exposed to, that you had this device implanted or this device was used in some way on you. And I think some of the other work that Anthony and others are looking at is mostly about that. This subgroup is about data that are generated from devices, waveforms, other kinds of high frequency data we might call numerics that come out of monitors and ICU or other parts of healthcare settings. And our goals are to develop the standard strategy for managing and representing those kinds of data. And that involves clarifying the extent to which we've got standard concepts for them in the vocabulary, developing a strategy for adding them where they don't exist, and then testing a previously developed strategy for mapping the data from those covered concepts based on stuff that we've done with this MIMIC data set, the wonderful freely available data from Beth Israel Deaconess that MIT has long curated and made available for free. It's been a source. So there's a mapping of mimic data to OMOP that we've been working on. And as a part of that work, we developed a strategy for taking waveform features or other device-generated data features and putting them in the CDM, and we'll be testing that out. And we're very excited about everybody who wants to join. This is I think, a pretty high value effort. There's a lot of really important information that you can get from these kinds of signals, and integrating them with the other kind of clinical data is a really exciting prospect. We hope many people join us.
Yes, so for the last group about device adverse event subgroup, the lead is still vacant. We are looking for the lead people who volunteer to lead this group and establish the group, identify the OKRs. And we have actually one activity that is related to this group. So hopefully the leaders will rise from there.